Hi, my name is Emily. I'm a student nurse practitioner. Are you Nate?
I am.
Okay. Today I'm going to be doing a chest, lungs, and heart assessment. Is that okay?
Yeah, that's okay.
Okay. So I'm just going to start by inspecting your chest. Um, I see no increased work of breathing. If you don't care to sit up for me for a second. I see no use of accessory muscles. You're not in a tripod position. I see no signs of barrel chest. I'm just going to palpate here. I feel no crepitus anywhere, which is to be expected, a normal finding. So comparing your back to your side is about 50% of your back, which is to be expected, the lateral versus the posterior. Again, just feeling, I don't feel any crepitus anywhere. Do you care if I look at your fingers for just a second? I see no signs of clubbing or cyanosis. Cap refill is less than 3 seconds. Okay, you can go ahead and put those down. And I'm just going to feel your trachea here, which feels midline. And then below that, we have your suprasternal notch. And then below that, the angle of Louis, which is all symmetrical, midline, how it should be. Next, I'm just going to have you turn to the side a little bit. And we are going to test for, what's it called? Thoracic expansion. So I'm going to put the palms of my hands kind of below your rib cage here. And I'm going to have you taking a big deep breath. And then exhale. So they expand symmetrically. My thumbs come apart, they come back together. Everything moved evenly. So that was normal. And then next, we're going to test tactile fremitus. So what I'm going to do is I'm going to place my hand on each lobe of your lung, front and back, and I'm just going to have you say 99 every time you feel my hand touch, okay?
Okay.
Okay, whenever you're ready.
99, 99, 99, 99, 99, 99, 99.
Okay, perfect. So I felt the resonance everywhere. It felt symmetrical on both sides. I'm going to have you say 99 again every time I put my hand on your chest, okay?
Okay.
Okay.
99, 99, 99, 99, 99, 99, 99.
Okay, perfect. Next, I'm going to check for diaphragmatic excursion. So first, what I'm going to have you do is exhale out all of your air. And you're just going to feel me percuss here. Okay, and then I'm going to have you take a breath and inhale all of your air. Okay, and then go ahead and breathe normally. So the distance between when you exhaled your air, when you inhaled everything is about 2 to 3 centimeters, which is normal. Now I'm just gonna auscultate over all of your lung fields. Just breathe normally, okay?
Okay.
Okay. And then take some big deep breaths for me every time you feel my stethoscope, okay?
Okay.
I heard all clear breath sounds. I didn't hear any wheezing, any rhonchi, rales, anything like that. Everything was clear, symmetric on both sides. And then his respiratory rate when he was breathing normally was 12, which is normal. And then now we're going to do the vocal resonance test for that. And what I'm going to have you do is say 99 again while I auscultate. That's how we're going to be testing it today. But there's also the Goffany test where you can say E. And if A is heard when I auscultate, that's a sign of consolidation. Or we can do the whisper test where you whisper while I auscultate and say 99 or 1, 2, 3. And I shouldn't hear any whispering or anything come through. And if I did hear it clearly, then that would be a sign for consolidation. But just for the purpose of this, I'm just gonna have you say 99 again, okay?
Okay.
And we're gonna do that on the front and the back. So go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Alright, I heard it nice and clear up top, and then it got duller as it went down to the bottom, which is a normal finding. Now I'm going to move on to assess your heart. So what I'm going to do first is I'm going to palpate with the ulnar part of my hand for any pulsations or heaves. Which I don't feel any anywhere. And then I'm going to shine a light on your chest here to also look for any pulsations. Which I don't see any there either, which is good. Now I'm just going to palpate your apical pulse down here, just to feel for thrills, which I don't feel any, which is a normal finding. And I also don't feel any lumps anywhere. And then I'm going to palpate each valve here for thrills also. So we have aortic, pulmonic, we have Erb's point, tricuspid, and mitral, which I don't feel anything, any thrills, any pulsations or heaves there. His chest looks symmetrical. And now I'm just gonna auscultate, okay?
Okay.
So I don't hear any murmurs with the diaphragm. And then now I'm gonna listen to the bell. I heard S1 and S2. still don't hear any murmurs. I didn't hear an S3 or 4. Everything sounded good as expected. No murmurs to grade or anything like that. Now, if you don't care, I'm going to have you lie on your left side so I can listen to see if you have S3 or S4 while lying down, which is more easily heard while you're lying on your left side, and just to auscultate the apex of your heart again, if you don't mind. I don't hear S3 or S4. I don't hear anything abnormal. You can sit back up. And I think that concludes our exam. Do you have any questions or concerns?
No, I don't.
Okay. Well, thank you for your time.